Hello, my good people. Thank you for making me part of your family or part of this big family. Common questions about breast development. Common questions about breast development. Those who have been requesting this topic, I hope your eyes are glued on your phones or whatever gadgets you are using, following each and every step of this topic because it's a very important topic, because these breast problems affect ladies each and every time. And before we continue, if you are there and you are watching us for the first time, just take a second or two, subscribe and put the notification bell on, so that whenever I produce a video like this, YouTube will automatically notify you and you'll never miss any of our content. For the returning subscribers, thank you, because it's because of you that this channel is where it is at the moment. Common questions about breast development. A point to note: in any case, it's important to be aware of normal development so that you can spot any potential issues early. Remember, we said even if it's a breast cancer and it is diagnosed early, for example, when it's at stage 1, it can be easily treated. That's why we are saying, if any case, it's important to be aware of normal development so that you can spot any potential issues early. In any case, it's important to be aware of normal development so that you can spot any potential issues early. And you can only be aware when doing your self breast examinations. So you will be knowing how your breast should look like when it's normal or during menstrual cycles, or how it should be after the menstrual flow or the menstrual cycles. You should be able to detect the normal and abnormal breast lumps. So, in any case, it's important to be aware of normal development so that you can spot any potential issues early. It's common to have questions about your breasts in different development stages, especially since every woman's breasts are different. It's common to have questions about your breasts in different development stages, especially since every woman's breasts are different. It's common to have questions about your breasts in different development stages, especially since every woman's breasts are different. That means you can't find two ladies or two women having the same type of breasts. Below are common questions women ask. Why are we talking about women? Because these lumps mostly affect the women compared to men. Below are common questions women ask. Number 1, or A, do breasts hurt when they grow? Do breasts hurt when they grow? I'm going to give you an answer. Do breasts hurt when they grow? And if so, why? Do breasts hurt when they grow? And if so, why? And the answer is simply yes, they hurt when they grow. And let me give you the reason as to why. Do breasts hurt when they grow? And if so, why? Yes, breasts hurt when they grow. Yes, breasts hurt when they grow. Breasts grow in response to the hormones estrogen and progesterone. So estrogen and progesterone are responsible for the growth of your breasts. Yes, breasts hurt when they grow. Breasts grow in response to the hormones estrogen and progesterone. As you enter puberty, levels of these hormones increase. As you enter puberty, levels of these hormones increase. As you enter puberty, levels of these hormones increase. Your breasts begin to grow under the stimulation of these hormones. So the estrogen and progesterone hormones are responsible for the growth of the breasts. So as you enter puberty, levels of these hormones increase. Your breasts begin to grow under the stimulation of these hormones. Hormonal levels also change during menstrual cycle, pregnancy, breastfeeding, and menopause. Hormonal levels also change during menstrual cycle. For example, during pregnancy, breastfeeding, and menopause. Hormones cause changes in the amount of fluid in your breasts. Hormones or hormonal levels also change during menstrual cycle, for example, pregnancy, breastfeeding, and menopause. Hormones cause change in the amount of fluid in your breasts. This may make your breast feel more sensitive or painful. Hormones cause change in the amount of fluid in your breast, and this may make your breast feel more sensitive or painful. I hope you are following this and you are getting each and every point correctly. Number 2 or B, or another question people ask themselves: should my breasts be the same size? This is a question I've come across from so many ladies. Should my breasts be the same size? Most women have variances in the size of their breasts. That means both breasts are not equal in size. So, should my breasts be the same size? Most women have variances in the size of their breasts. It's normal for a woman's breast to slightly differ in size or even vary by whole cup sizes. Should my breast be the same size? Most women have variances in the size of their breasts. It's normal for a woman's breast to slightly differ in size or even vary by whole cup sizes. So when your breasts differ in size, one is bigger than the other, this is very common. So you should not be worried about this. This is especially common during puberty when your breasts are still growing. This is especially common during puberty when your breasts are still growing. Large difference in size is generally not a health concern. Or when you possess large breasts, this is not a disease. So large difference in size is generally not a health concern. Or if you find one of your breasts is more bigger than the other, this is not a health concern because it's normal depending on your hormonal levels. The third question you should be asking: does a lump in my breast mean I have cancer? Does any lump in my breast mean I have cancer? While performing breast self-exams to look for lumps in your breast can help in early cancer detection. Does a lump in my breast mean I have cancer? While performing breast self-exams to look for lumps in your breast, this can help in early cancer detection because you already know how your breasts feel like on palpation. So whenever there is a difference or something else growing around that breast, you can as well detect. So while performing breast self-exams to look for lumps in your breast, this can help in early cancer detection. Lumps don't necessarily mean cancer. Lumps don't necessarily mean cancer. The main reason for self-exams is that they help you learn what is normal for you or yourself into brackets. The main reason for self-exam is that they help you learn what is normal for you into brackets yourself. A point to note. For some women, having some lumps is normal. For some women, having some lumps is normal. With regular examination, you notice that the lumps come and go with your menstrual cycle. The main reason for self-exams is that they help you learn what is normal for you or yourself. A point to note. For some women, having some lumps is normal with regular examination and with a point to note. Some women having some lumps is normal with regular examination. You notice that the lump is normal with a regular examination. So with the regular examination, you notice that the lumps come and go with your menstrual cycle. Let me repeat this again for more clarification. Lumps don't necessarily mean cancer. The main reason for self-exam is that they help you learn what is normal for you and yourself. A point to note, some women having lumps is normal with regular examination. Some women having some lumps is normal and with regular examination you notice that lumps come and go with menstrual cycle. When you find a lump for the first time, let your doctor know. Some needs drainage or even possibly being removed if they are uncomfortable. So if the lump is uncomfortable, it can be removed. This marks the end of our video today. Let's continue subscribing, liking and sharing our videos so that they may reach as many people as possible. Let's meet in the next video tomorrow.